everyone. Welcome back to the Grow RDH podcast. My name is Katie, and I'm going to be your host today. Today, we are going to be talking a little bit about something different. Still going to have some ethics conversations, but today, instead of talking about our clinical work or maybe some risk mitigation, today I thought it would be kind of nice to switch it up and talk a little bit about overall self-care and wellness for dental hygienists. And I'm going to title this episode The Ethics Behind Vulnerability and what vulnerability might look like for us as dental hygienists. I think this is an important topic, and it is going to lead into some more conversations I think that I want to have with you down the road about, just wellness and self-care. But really today I want to focus on the theme of vulnerability and why vulnerability might be something really important for us to be thinking about in our daily practice. Because I think that the dentistry field in general and the climate right now, or the environment that I'm experiencing and I'm hearing from others, is that, after COVID, I know we had a lot of hygienists leave the workforce, and dentistry can be and is sometimes very stressful. I know we don't always seem to associate ourselves with the medical field, but when COVID happened, we really noticed a lot of the similarities there. And as hygienists left the workforce, we had a lot of staffing issues. There's still a hygienist shortage in a lot of the areas in the whole country, but specifically where I am in South Dakota, we are very short on hygienists. But even before that, even before this shortage was happening, dentistry, I think, in general, is very different than the medical field. And what I've noticed in my practice is us as hygienists specifically, we see a lot of our patients very regularly. We see them every 3 months, sometimes every 6 months, and we spend almost an hour with them. And we do have the ability to take on some, when we're building relationships with them, when we're trying to be empathetic, we do take on a lot of emotion from them. And sometimes that's good and sometimes that's bad. It can be sometimes emotionally draining. I know sometimes when with patients, they'll tell me things that I almost become sort of a armchair therapist, if you may, just because you have a relationship with him. It's almost like going to a hairdresser that you see very regularly, and the relationship crosses the boundary into personal issues or just things that they're dealing with in their everyday life, which again is great when it comes to building relationships with our patients. So we're going to talk a little bit about vulnerability and how that might show up in our practice. One of the biggest things I think that we can kind of segue back to what we talked about the last few weeks is we have a lot of legal risk, right? We're trying to protect ourselves professionally, and so we do take on a lot of checking the boxes. We have to check the boxes of everything we do to make sure that we're protecting ourselves from any wrongdoing. We also want to make sure we're protecting our office. We want to build societal trust with our patients, and we want to protect the patients. We want to help them make the best decisions. So all of that together leads us into a situation where we have a lot of pieces to the puzzle that we're trying to fit in, and that can be very draining. That presents a lot of risk, a lot of factors that we're trying to balance. And sometimes that can be very draining, just professionally. Again, like I said, we have a lot of staffing issues. And so with that comes a lot of more duties that we might not normally be taking on. That or we're just really, moving at a very quicker pace. We're trying to get everything in We're trying to see as many patients as we can. And when we're in those situations, again, because we have that risk in the back of our mind, we need to make sure that we are keeping up with the standards of care and trying to get everything in as well. And so that can lead to some very specific types of patient encounters. Some of our patient encounters can be negative. I know when we talk about dentistry, even anytime you're in a public job, right? Retail, for example. I know I worked retail for a while during college, and some of my first jobs were retail jobs or public service jobs where you're dealing with the public, and those encounters can be good and bad. But I tell you what, even in retail, some people, yes, they were difficult, but never to the level of what I've experienced in dentistry. It's very rare, I think, in other fields, I guess. I mean, there's multiple times a day where a patient will sit down and be like, I hate coming to the dentist. I hate this. I don't want to be here, And so that is, as much as we don't want to internalize that, I think we can internalize that. And that experience, while we try to sort of build up these professional walls and boundaries, when it happens over and over and over again, it does become somewhat draining, and we internalize it probably more than we think we would internalize it, and that can be stressful. Sometimes our patient encounters are positive in our relationship building, right? Maybe we have a patient that's really dealing with something heavy, or they just got a new diagnosis from their doctor and they're coming into the dentist to sort of help co-manage a condition. And so while that relationship is positive and we're helping our patients, and that's a positive thing, again, that encounter, though, maybe has a negative context, or we're helping them deal with something heavy. No, we're not therapists, but the amount of time that we spend with them, again, we sort of internalize some of that, and we see them so often that they just become, borderline friends, and we want the best for them. So when they're dealing with something that might be hard in their personal life and they come to us and tell us about it, again, we're going to internalize that a little bit. And it's great that they can feel vulnerable with us, but that negative emotion that we're sort of taking on for them can be, again, sometimes emotionally draining. And then we have the patient encounters that are really positive, and maybe we do have the opportunity to build that relationship, and we have the opportunity to be a little vulnerable. And I think that's a good thing. I think that when we can share about our lives, again, we want to always maintain our professional boundaries, but I think that those patient experiences might offer us a little bit of an opportunity to let us be vulnerable with them. And I think that it's so neat or interesting when the patients view us as humans, right? It sort of humanizes us, and it allows us to present a side of ourselves that the patient can connect with on a human level. I think that's so important when it comes to building patient relationships, because it's hard to build a really empathic or even or one-on-one relationship without that aspect. And so I think it's important too for us to be able to be a little bit vulnerable with our patients. And I think all of that is sort of related to how quickly we're going to burn out, or how much resilience we build to prevent burnout. So what are some of those things that we can do? So instead of focusing on the bad, we want to focus on the good. So we talked about, legal risk. We talked about lack of staffing, we talked about some of those negative encounters. What are some of the things that we can put in place in our daily practice that might help us deal with some of those vulnerabilities that we have and use them to our advantage and reduce the chance of burnout? One of those things I think is to maybe identify some safe people or patients. You could be patients, but if they're not in your schedule that day, but even people at work or people in your life that you can use to be vulnerable with. So maybe you have a really negative patient experience. Is there somebody at your workplace where you can sort of de-stress with or chat with about that? HIPAA confidentiality, that's always a concern of ours, but even without sharing any of that information, I think we can share those negative experiences and be able to share them in a safe place with people that understand the emotional internalization that we sometimes do as dental professionals. And so identifying some safe people at work that we can talk to and connect with, and maybe even having a safe area or having a place at work where you can sort of go, and when people know that you're going there, maybe it means you need 5 minutes, or maybe it means that, hey, I just would like to chat with you. I just need a little bit of a minute. So identifying some people at work or even places at work where you can sort of just kind of take time to process everything that you're experiencing. I think even if you don't have those places, I think having the opportunity to sort of build that into your schedule, about building, I want to say mindfulness. Mindfulness is such a hot topic right now, and it's such a buzzword. To me, it almost seems cliche, but I think it is a buzzword because it's really important. And so even if you don't maybe have like a safe person at work that you can go talk to, or you don't have a safe like room or a time, maybe you don't even have 5 minutes in your schedule because you're that far behind, or you're that pushed, patient to patient. Maybe it's while you're doing your notes, you do a little stretch, or maybe it's making a routine and doing some affirmations, at certain points during the appointment. Maybe as you're getting ready to, maybe every time you finish your oral screening and you're getting ready to probe or something, you have a routine or you have a touch point that you can do or say or take a minute or breathe. Something that focuses your mind back into the present and lets you sort of ground yourself so you're more aware and prepared of your surroundings. So you're not just in this grind and you can't get out of it. I think having a touch point or having some piece of routine in your day could be really, really helpful. I know I try to do this, but again, we're all human and we all sort of get out of our routine sometimes. But trying to come up with something that helps you sort of get out of that mindset of really high stress or high emotion can help you get back in the zone or feel more self-aware or ready to respond to the emotions that you're going to be dealing with. And then again, we sort of already touched on this, but sharing vulnerable experiences with patients. In my experience, so I gave the example of maybe like a patient who had a diagnosis or something. Just being an ear to listen, again, that's great, but we can internalize that. But if we use that opportunity as a way to build a relationship with them, maybe it is a diagnosis that you are familiar with, and we don't want to always one up somebody, but if you can just connect with them and even just try to show understanding that, yes, I hear you. I see you. That must be really hard. And if you're feeling open to it, maybe you share an experience about maybe a family member or somebody that experienced that as well, and something that you can sort of connect with them, that they feel heard, I guess. That would be one really good way to do it. Um, Even just sharing vulnerabilities about your personal life. But, it's so hard. We always want to keep our professional boundaries up. But even if it's something, maybe it's a patient that you've been seeing for a long time and you have a really good relationship with them, maybe sharing something good that's happening in your life or something positive that happened to you. Um, and so you're just kind of giving them an olive branch of like, this is what's going on in my life, and this is me. And I think what that can do for us is that it starts to, again, open up the patient's eyes to see that we're human too. We're not just, this eye, set of eyes behind a mask that is there to just clean their teeth and be done. And I think when we can humanize ourselves, it makes their reactions, especially the negative ones, it makes them more empathetic to us. And that is huge. I think when we can do that and we can humanize ourselves and make them see us as partners in daily life, and not just, this person that is poking that thing in my gum and it hurts. I think they're better to react. That's just in my experience. But again, all patients are different. And I do think it's important we have the ability to determine what patients are safe to do this with, right? We know that not all patients are going to react to that in the same way. And so we do just have to be careful. We always have to keep our professional boundaries up, and we need to kind of tread lightly. But I do think that when we can be vulnerable with the patients, it makes us more human. So that is my talk today. And hopefully this sort of leads us into more conversations about mindfulness or self-care. Self-care is such a huge topic right now. And I think a lot of the time self-care gets sort of this, like, you have this picture of a bubble bath or chocolate and, little eye gel pack thingies. That's great. That'd be awesome if, we all had the time and capacity to do that all the time. But what I think of self-care, I think more in terms of we need to take care of ourselves. And so I want to explore more of this self-care ideas. But for now, I think some self-care things that are really easy to do that help us with our emotional capacity, and it's kind of related to that mindfulness piece or having a touch point or something like that. But I think self-care can go a long way with some very, very minor things that we can do for ourselves. And when I say self-care, I'm thinking more like, how do we set ourselves up for like our future self? If we're talking day to day, what can you do at 4 p.m. before you leave the office to take care of yourself tomorrow, right? What are some things that we can do? Sometimes self-care might be just be like, I got to get out of here. I got to get home. I am going to do this later. But I think if we looked at it the opposite way, self-care could be, what can I do for myself right now that will help prepare my tomorrow self for being able to tackle the day? Maybe that means looking at tomorrow's schedule and printing it out early, or maybe it means having my trays lined up where I usually have them, or getting, setting out all my polisher sterilization bags where I want them, or pulling out the polishing paste. I'm giving silly examples, and I don't know what that example might look like for you. But to me, I just think that self-care is easy. And while we might not want to do things like that at the moment, just think how happy and how streamlined our next day could be if we sort of look to the future and do that for our future self. This also could be things not work related, but more health related. Self-care could be drinking enough water. Maybe you avoid drinking water in the morning because you don't have time to go to the bathroom, but you know that at the end of the day, you have a raging headache and you're dehydrated, and it's just something you're dealing with because you feel like you can't do it any other way. But maybe self-care for you looks like, how do I hydrate in a way that I stay healthy, but yet I'm not running to the bathroom every 20 minutes? How do I maybe set aside little snacks during the day so I can stay energized and I'm not drained? And that might improve my mood. So when I do have those negative patient experiences, I'm not hangry about it. And I'm better. I have more cognitive ability or cognitive capacity to deal with some of those negative experiences. Maybe I know that going for a walk in the morning just really pumps up my mood and gets me happy. So that's self-care, because I know I'm a happier person when I have a little bit of exercise in the morning, and that sets my day right. Maybe that's self-care for us. But any of those things, and again, those are just some silly examples, but I really do think that while sometimes they're not the easiest thing to do all the time, and sometimes when we're, really feeling drained, they might feel like that's the last thing I want to do. But I think for us and for our well-being and our emotional capacity, our mindfulness, all of those things can be tied to how well we are able to stay vulnerable and handle our vulnerability in a way that's professionally sound. So that is today's podcast. There's so many things there. There's so many layers there that I hope to explore in the future. I think self-care could have its own episode in total. I think vulnerability could have its own episode in total. I think emotional internalization will likely have its own episode. But I just wanted to introduce the topic and kind of see what you guys think. How do you practice self-care? How do you deal with vulnerability and deal with that humanization of you as a practitioner? And how do you handle that boundary with your patients? Those are all questions I'm curious about how you do it. And so thank you for listening. Thank you for liking and subscribing. Please do that. It really helps. And I hope to continue this conversation. So please head over to growrdh.org and you'll see the blog post associated with the podcast. And you can follow me on any of the socials and comment on any of the videos tied to this podcast. And just let me know, how do you guys handle self-care? How do you handle vulnerability with patients? And we will continue the podcast next Friday. So I will see you then.